Imagine you're driving this absolute top-of-the-line Ferrari, right? But instead of standard brakes, it's got bicycle brakes.
That sounds completely terrifying, honestly.
Right, because every single time you see a billboard or another car or even just a slight bump in the road, that massive engine roars to life. You accelerate instantly, but you physically cannot stop yourself from swerving. The brakes are completely shot.
Yeah.
Now imagine trying to navigate your career, your relationships, your entire life in that car. For over 6% of adults worldwide dealing with symptomatic ADHD, this isn't just some clever metaphor. It's their daily, highly frustrating reality.
It is, yeah.
Welcome to the Deep Dive. Our mission today is focused entirely on you, the listener, or perhaps the adults in your life who feel like their brain's brake pedal is just, well, failing. We're jumping into a fascinating 2025 systematic review and meta-analysis published in the Journal of Global Health.
It's a fantastic paper.
It really is. And it asks this provocative, almost unbelievable question. Can working up a sweat actually rewire the adult brain to build a better brake pedal?
It's just a phenomenal question to dig into, honestly, because, for decades, the standard protocol for adult ADHD has been incredibly rigid. We're talking about pharmacology, cognitive behavioral therapy, and mindfulness training.
The usual suspects, basically.
Exactly, the gold standards. But the data consistently shows that while those things manage general symptoms, they often fall short in improving very specific, deeply ingrained cognitive functions.
Right.
They act as a patch, but they don't necessarily fix the underlying structural deficits. That makes this new research on physical activity incredibly vital for anyone looking to genuinely optimize how their brain operates under pressure.
Okay, so let's establish some ground rules before we get to the gym. To understand how going for a run or, taking a fitness class fixes the problem, we need to know what the problem actually is. When people hear ADHD, they usually picture an 8-year-old bouncing off the walls in a classroom.
Which is a common misconception, yeah.
Right, but we are talking about adults here. Why do adults with this condition struggle so intensely with impulsivity?
Well, it comes down to a core feature of executive dysfunction. In adult ADHD, this manifests as a severe lack of what neuroscientists call inhibitory control.
Inhibitory control, so the brake pedal.
Yes. Simply put, inhibitory control is your brain's ability to overcome a strong automatic response to an external stimulus.
Can you give me a real-world example of that?
Sure, let's put this in context. Imagine you're in a high-stakes meeting and a colleague blatantly takes credit for your work.
Oh, wow. Yeah, that would sting.
Right. Your automatic, highly emotional response might be to interrupt or yell or literally storm out of the room. Inhibitory control is the rapid cognitive mechanism that suppresses that primal urge.
So it's the pause button between feeling the impulse and actually acting on it.
Exactly. It's what allows you to stay seated, take a breath, and formulate a calm, professional response instead. And when that pause button is broken, you get impulsive or hyperactive behavior.
Which has real consequences.
Massive consequences. It literally impairs a person's functional independence. It affects their financial safety, their career progression, relationships, all of it. And on top of that, adult ADHD also features these measurable deficits in spatial working memory and long-term planning compared to healthy adults.
So they have profound trouble self-organizing.
Yes, and processing complex tasks because they just can't filter out the noise. They're reacting to everything all at once.
Which brings us right back to that Ferrari with the bicycle brakes. You're reacting to every stimulus on the road, but the stopping power just isn't there. But what I really want to clarify for the listener is why this is happening.
Because society often treats it like a character flaw.
Exactly. Like, oh, you just need to try harder to pay attention. But if the brakes are failing, we need to look under the hood. What is physically and chemically happening in the ADHD brain that causes this utter lack of control?
Under the hood, it is a highly complex combination of chemical starvation and actual physical structural differences.
Wow. Okay, let's start with the chemistry.
Right, so ADHD is heavily linked to a specific chemical soup in the brain, an imbalance of neurotransmitters. The big culprit here is a dopamine deficiency. Dopamine is the chemical messenger that manages our reward mechanisms and our sustained attention.
So if you're fundamentally deficient in dopamine, your brain is just constantly starved for stimulation. It sounds like a bored toddler desperately looking for a reward anywhere it can find one.
That is exactly why the sports car is speeding. The brain is hunting for its next dopamine hit through novelty or, distraction. But it's not just dopamine. We also see decreased levels of norepinephrine.
Which does what exactly?
That manages your baseline arousal and alertness. And we also see altered expression of serotonin, which helps mediate impulses and emotional regulation. So the whole chemical environment is fundamentally altered.
But you mentioned it's not just a software problem, right? The actual hardware of the brain is different.
Yes, it is. Brain imaging has shown us that adults with ADHD actually have reduced gray matter volume in key command areas. Most notably, the prefrontal cortex, which is basically the brain's command center for inhibition and decision-making.
The prefrontal cortex is physically smaller.
Yes. And the white matter volume, which you can think of as the brain's communication superhighway, is also reduced.
Okay, so the command center is physically smaller, and the highways connecting it to the rest of the body are literally narrower.
Exactly. And functionally, this leads to incredibly chaotic activation patterns. The prefrontal cortex shows significant underactivation.
Asleep at the wheel.
Essentially, yes. Meanwhile, the sensory motor networks and the visual processing centers show overactivation. They are firing on all cylinders, processing every little sight, sound, and movement in the room, while the command center is just too quiet and too small to filter any of it out.
Okay, I have to stop you and push back here, because this is the crux of the whole deep dive.
All right, go for it.
If the brain literally has less gray matter in the frontal lobe, and the chemistry is physically starved of dopamine and serotonin, how can we possibly expect hitting the treadmill to fix a structural lack of brain tissue?
It's a very fair question.
I mean, you can't run your way to a bigger foot. How do you run your way to a bigger prefrontal cortex?
It is the most logical question you could ask, really. For a long time, neuroscience assumed the adult brain was fixed. The assumption was, well, the hardware you had in your 20s was the hardware you were stuck with until it started to decline.
Right, that was the old consensus.
But what we know now is that the brain is incredibly plastic. It is a highly adaptable organ. Physical activity isn't just a distraction to tire you out. It's a profound physiological intervention that forces the brain to rewrite its own hardware. Which brings us directly to the findings of this 2025 meta-analysis.
Let's get into those results. So the researchers pulled together 8 randomized controlled trials involving 373 adult subjects aged 18 to 50. And the big takeaway from all this data, physical activity has a mathematically massive positive effect on inhibitory control.
It's a huge shift.
Yeah, the physical activity groups had significantly faster inhibitory response times than the non-exercise groups. But I want to translate the statistics here, because reading raw numbers from a medical journal can sound like, I don't know, reading a stereo manual.
Oh, absolutely.
The data showed an effect size that is considered exceptionally large in the scientific community. To put it in perspective for you listening, the group that exercised didn't just see a tiny, barely noticeable improvement. Their reaction times and focus leveled up so much it was comparable to the effects you might hope to see from clinically effective interventions.
It is a staggering finding. The exercise groups were objectively, measurably better at pumping those cognitive brakes. But what makes this review so useful is that the researchers didn't just stop at saying exercise is good.
Right, they dug deeper.
They split the data to look at how different durations of exercise impact the brain. They divided it into acute exercise and chronic exercise.
Acute meaning a single session. You go to the gym once for less than 60 minutes. Chronic meaning a long-term intervention lasting anywhere from 6 to 24 weeks. Basically, it becomes a lifestyle routine. So what's the difference in the brain?
The data tells a very clear story here. Acute exercise showed a solid, immediate, positive effect. One single workout definitely helps, but chronic exercise showed an astronomical effect size.
Wow.
The long-term benefits absolutely dwarfed the single-session benefits.
So what does this actually mean for your daily routine? Let's say I have a massive presentation at work at 2:00 p.m. Does this mean I can just go for a 30-minute run at lunch to fix my focus? Or do I need to train like an Olympian for 6 months before I notice any real difference in my impulsivity?
Well, it's not an either-or scenario. It's about the mechanism you are activating. A single 30-minute bout of vigorous aerobic exercise, getting your heart rate up on a stationary bike, for instance, provides an immediate chemical flush.
Okay, so it works right away.
Yes. It briefly allocates attention resources, floods the brain with oxygen, and noticeably shortens reaction times. So yes, if you have a big presentation, that acute lunchtime run will give you a very real, immediate cognitive boost.
The pre-meeting run works for the software.
It does. However, the long-term chronic exercise provides the lasting structural benefits for your inhibitory control. That's where we start seeing the potential for actual changes in the brain's hardware, rather than just a temporary chemical nutrient delivery.
Okay, so knowing that we need to make this a chronic habit is great, but does the type of exercise matter? Because the study compared a whole showdown of different physical modalities. We're talking Pilates, cycling, yoga, Tai Chi, vibration training.
And the results of this modality showdown were incredibly varied, which tells us a lot about how the brain responds to different types of movement.
Let's look at the winners and losers. Pilates showed the greatest effect on inhibitory control by far. It was off the charts.
Massive effect size, yes.
Tai Chi also had a massive effect size, although the paper notes the data spread made it less statistically ironclad. Cycling was a highly reliable, rock-solid performer across multiple studies. But the absolute loser in this data set, the modality that showed practically zero effect on ADHD inhibitory control, was yoga.
That is what the data from these specific trials indicated, yes.
I have to admit, I completely validate that data personally. You tell an ADHD brain to, find stillness and empty the mind on a yoga mat, and suddenly I am mentally planning my groceries, stressing about an email from 4 years ago, and wondering how the factory manufactures the foam block.
It's a very common experience.
But here's where it gets really interesting for the listener. How on earth can Pilates be the ultimate magic bullet while yoga, which to a layman looks somewhat similar in terms of breathing, holding complex poses, and body awareness, does practically nothing for building that brake pedal?
We have to be very careful with how we interpret this specific data point. The researchers themselves noted high heterogeneity in the studies, meaning the exact ways the trials were conducted varied a lot. And importantly, there was only one study included for Pilates.
Oh, just one.
Just one. So we cannot definitively call it a magic bullet based on a single trial, but we can absolutely look at the biomechanics and the cognitive demands of these activities to explain the stark difference.
Let's hear it. Why the difference?
Well, different physical activities demand entirely different cognitive loads. We classify exercises as closed skill versus open skill, or cognitive motor training versus purely aerobic.
Okay, where does Pilates fall?
Pilates, particularly on a reformer machine or even advanced mat work, requires constant, intense cognitive motor engagement. You are actively controlling tiny stabilizing muscles, constantly adjusting your posture, and fighting against the resistance of springs.
That's a lot to think about at once.
Exactly. It's a high cognitive load that forces the prefrontal cortex to stay engaged every single second.
You literally cannot let your mind wander in a tough Pilates class, or you'll lose your balance, your core will collapse, or the reformer spring will literally snap you back. You are forced to pay attention to your body.
Yes, forced is the key word. Yoga, while physically demanding and wonderful for flexibility, often encourages the mind to release, to find stillness, or to detach from active, forceful executive control.
Which is great for relaxation, but maybe not for training ADHD brains.
Right. It's fantastic for overall stress reduction, but it isn't necessarily training that specific brake pedal the way a highly coordinated, attention-demanding Pilates routine might.
That makes total sense. You're practicing the art of focus. And what about cycling? Why is that such a reliable performer in the data?
Cycling is highly recommended because it improves physiological arousal without creating internal noise.
Internal noise.
Yeah, you get the heart pumping, you elevate the breathing, but you don't have to think about complex footwork, choreography, or team strategy. You just push the pedals. This floods the brain with oxygen and neurotransmitters without overwhelming the sensory processing centers that are already hyperactive in the ADHD brain.
Okay, so we know the what now, but we need to satisfy the how. I really need to visualize this. If I am just spinning my legs on a bicycle or balancing on a Pilates machine, how does that physical motion travel up my spine and suddenly make my brain better at ignoring distractions in a boardroom?
Let's break it down.
Walk me through the actual biology of how we fix the X-ray.
Okay, let's start with the chemistry we talked about earlier. Physical exercise directly induces the release of dopamine. When you engage in moderate to vigorous physical activity, you are giving the ADHD brain the exact chemical reward it is desperately seeking.
So you're giving it the fix it wants.
Exactly. This instantly acts on those reward processing deficits. You are feeding the starved toddler, calming that constant chaotic search for external stimulation.
Okay, so the workout gives us the dopamine hit. That's the chemical side. What about the physical structure of the brain? The lack of gray matter we talked about.
This is where neuroplasticity comes in. Acutely, exercise acts as an immediate nutrient delivery system. It dilates blood vessels and increases blood flow and oxygen directly to the prefrontal cortex and the basal ganglia.
And chronically, over time.
Chronically, over weeks and months of doing this, physical activity can actually increase the physical volume of the prefrontal cortex and the total amount of gray and white matter in the hippocampus.
Wow. It is literally growing the tissue of the brain's command center.
Yes. It enhances the regenerative ability of nerve cells. But even more impressively, it improves functional network connectivity. For example, brain scans show that consistent exercise improves the neural connectivity between the right cerebellum and the right inferior frontal gyrus.
Let's translate that for the listener. What do those two areas actually do?
The cerebellum handles your physical motor control, your movement and balance. The inferior frontal gyrus is a key hub for cognitive inhibition, your pause button.
Oh, I see.
When you exercise, you are essentially building a thicker, faster, more insulated fiber optic cable between your body's movement center and your brain's brake pedal.
Let's use a new analogy here because neuroplasticity can sound like magic. It's almost like blazing a trail in a really dense forest. At first, suppressing an impulse in a meeting is like walking through thick brush. It takes massive effort, you get scraped up, and it's exhausting.
That's a great visual.
But consistent Pilates or cycling acts like a machete. The more you force your brain to focus on the movement and the more oxygen you pump into those specific areas, the clearer that path becomes. Until suddenly, pausing before you speak in a meeting isn't a struggle through the brush anymore. It's a paved highway.
That is a brilliant way to conceptualize it. When you perform complex movements or sustain a high heart rate, you are forcing the brain to practice allocating its attention resources. Every time you successfully execute the movement, neurons wire together.
Firing and wiring.
Exactly. You are functionally training the prefrontal cortex to resolve conflict and suppress automatic responses. It is a literal physical workout for your cognitive brakes.
It sounds incredible when you lay out the biology step by step like that. But as critical thinkers, we have to look at the flaws in the data. No study is perfect, and we owe it to the listener to be entirely objective here. What are the limitations of this meta-analysis that we need to be aware of?
The researchers were very transparent about the limitations, which is always a good sign in science. First, there are significant blinding issues. In a clinical drug trial, you give someone a sugar pill, and they don't know if they're getting the real medication or the placebo.
Right, the double-blind standard.
But you cannot blind a participant to the fact that they are exercising. They know they are sweating on a bicycle. The researchers know they are on a bicycle. This inherently introduces some performance bias and expectation bias.
You expect to feel better because you know you just work out. What else?
They noted potential publication bias. The researchers used analytical tools to look at the spread of the data, and they warned of a common blind spot in science, the desk drawer problem.
The desk drawer problem.
Yeah, essentially, studies showing that an exciting intervention like exercise works are highly likely to get published. Studies showing that an exercise program did absolutely nothing often just sit in a scientist's desk drawer and never see the light of day.
Which can completely skew our overarching view of the data.
Precisely. And finally, as we touched on with Pilates and Tai Chi, the sample sizes for those specific niche exercise programs were quite small compared to the broader aerobic studies.
So given these blind spots in the research, the inability to blind subjects, the desk drawer problem, the small sample sizes for certain classes, should you, the listener, still view exercise as a primary tool for managing your attention and impulsivity?
This raises a fantastic point about how we apply scientific data to our daily, messy lives. While more research is absolutely needed to dial in the exact clinical dosages of exercise for ADHD, the risk-to-reward ratio of physical activity is simply unparalleled.
Meaning the side effects of trying this intervention are what? Getting physically fitter, sleeping better, and having a healthier heart.
Exactly. It has incredibly high compliance and feasibility. Even if a Pilates reformer class isn't a guaranteed, universally proven magic bullet for every single person on Earth, moderate to high-intensity exercise, especially chronic multi-skill activities, is a proven protective factor for the brain.
It just makes everything run better.
It manages those core executive symptoms, it naturally increases dopamine, and it dramatically improves overall quality of life. The downside is virtually non-existent compared to the potential cognitive gains you stand to make.
So, to wrap up this deep dive for you, if you or someone you know struggles with the impulsive, hyperactive, or even the inattentive aspects of adult ADHD, Physical activity is not just about fitting into an old pair of jeans or managing your blood pressure.
No, it's so much more than that.
Consistent, chronic exercise, whether that is the sustained arousal of cycling or the intense, hyper-focused cognitive demands of Pilates, is a scientifically backed way to physically and chemically upgrade your brain's inhibitory control network. You are literally clearing the brush in the forest.
You're changing the actual physical structure and the chemical environment of the brain to give yourself back your pause button.
And I want to leave you with a final provocative concept to mull over on your own time. We just walked through how a few weeks of targeted physical activity can literally rewire the adult brain's structural brakes and alter the actual physical volume of our prefrontal cortex.
If that is true, what other hidden cognitive upgrades are waiting to be unlocked simply by moving our bodies in specific challenging ways? If we can upgrade the brakes just by pedaling a bike or balancing on a mat, what does it take to upgrade the steering wheel? Thanks for diving deep with us today. Keep asking questions and keep moving.